So, good evening, dear friends. And in this World Diabetes Month, which we call it as, so the 14th November was the World Diabetes Day, and now we have a World Diabetes Month. It's almost gone for a month. And we, as a physician, as a hospital, take this opportunity to educate our public about the diabetes and try to mitigate some of the myths which is common in the society, and also give them a tips to cope up with this disease in a longer run. So today I have been given with the topic of diabetes in the children, and I feel this is a one topic which is very close to my heart in a forms of and being an MD pediatrician, so I know how children suffer from the diabetes, and we do see it on a daily basis, children with diabetes. Now, there are two things which is important for every parents to understand about their children's diabetes. One, what are the type of diabetes which we see and how they can be tackled with. So diabetes in children is something like commonly what we see, and I can say even maybe 5 years before, even 10 years before, we used to see only type 1 diabetes. Now you may ask me what is type 1 diabetes, and the common answer is that it's a diabetes which is of children, and the type 2 is something which happens in the adult. But yes, the scenario has changed over the years, and we have a different patterns. But the important thing to understand is type 1 diabetes is always much more dangerous than the type 2 diabetes, and it contains a risk of ketoacidosis, where your body start making ketones, and finally you have lot of acid forming in your blood, leading to difficulty in the breathing, and which can land up into the coma also in children. So it is very important to recognize the type 1 diabetes early and treat them at the earliest with the help of insulin. That's the most important thing. So usually onset, when we talk about the type 1 diabetes, is either in the early childhood when the children are less than 5 years of age, or usually it happens when they enter into the puberty, typically when they change from the childhood to the adulthood. That's typical age of 11 to 16 years of age. And in this, the typical symptoms which you can feel that the children will have lot of increased urination and weight loss, and these two symptoms suggest that probably my child may go into the diabetes, and that's the time when we should take this child to the doctor. And even if your doctor is not able to understand what is happening, you should always prompt them to look for the sugar. That's very important. Sometimes it does happen that we delay the diagnosis, not suspecting, because this is not very common diabetes happening into the children. So, and moment you have a sugar high, it is always good to connect with your physician or endocrinologist to just to find out that what is the type of diabetes your children have. And usually we do treat them with the insulin. Now the important thing is, can the insulin be stopped in the type 1 diabetes? The answer is no. That is one thing which we see is the most common cause of death in the children, because unknowingly parents stop the insulin for a few days, and finally this child will end up with the diabetic ketoacidosis, and they have a typical severity where they usually it's become difficult for us to bring them back from that severity. So it is always very important that we look at the children's diabetes and never ever try to stop their insulin even for one dose. That's the most important thing. Now, the other question which parents do ask me very commonly, even if we cannot stop the insulin, can we decrease the dose? Can we decrease the frequency? It has hampered the life of my child. But remember, there are multiple, numerous examples in the history who were with the type 1 diabetes and have won the Olympic race. The very famous bowler Wasim Akram was with the type 1 diabetes, and we all know what he has achieved in his life. So it is very important that we understand that yes, it's a type 1 diabetes. Children will be as normal as other people, except that they have to be on the insulin, and little bit of diet and exercise is required. So if we talk about, so we need to understand there is no alternative medicine, whether it is in our allopathy or in the Ayurvedic or even in the homeopathic. So type 1 diabetes on insulin, always insulin, has to be on the insulin till we as a researcher find some other alternative. and I'll be the most happy person when we will be in a position to stop their insulin. But unfortunately, as of now, there's none. Even the people talk about the stem cell therapy and they pay money in lakhs and lakhs, and ultimate result is they may be off insulin for 6 to 8 months, but finally they have to go back onto the insulin. So it's good to not try all this kind of thing. The second thing which is important when we talk about the diet, a lot of, especially the moms ask me that what should I do? My child doesn't like this, and if I have to give this, they will become rebel. And the second, they like this so much they cannot be without sweet. So we need to understand that this child can be on almost every kind of food. The only thing is we have to change the eating habit of whole family. I mean, this is something where everybody has to sacrifice for our own child so that they do not even get attracted towards the food which is not good for them. And another important thing which we talk about the type 1 diabetes is the low blood glucose, and that is something which can happen when the child takes insulin and doesn't eat well. Nowadays, there are insulin which can be given even post meal so that the parents know that how much the child has eaten, and accordingly they can adjust the doses so we can avoid the hypoglycemia. However, still hypoglycemia does occur, and that when there is a hypoglycemia like the low blood glucose, in that case we need to recognize it promptly and treat it. It can be as dangerous as diabetic ketoacidosis in children with type 1 diabetes, and it should be always treated with either glucose of the 3 spoon of glucose or with a 200 ml of cola or 200 ml of fruit juice, whichever is available at the earliest, and we should always seek the medical intervention if it doesn't get corrected. The second important thing is what are the other type of diabetes which children can have. So now when the obesity is increasing, and when I was doing my DM course, I had this opportunity to see about the obesity trends in Delhi area, and when I went to school, I found that almost 25% of the children were either overweight or obese. So that means we are going to deal with the huge problem in the near future with the children coming up with the type 2 diabetes. Now the type 2 diabetes is something which happens usually in the adults after 30 years. Now we say after 30 years, earlier it was after 40 years of age. So if this is happening at the 10 to 12 or 16 years of age, you can understand that how severe this can be the problem. Because now the children, and this type 2 diabetes is something which is not given by the God. Type 1 diabetes are, yes, they are unfortunate children where they have got this disease because of their own bad luck, where they did not have any control over the disease. However, type 2 diabetes is something which is the fault of our own humankind. We have made the availability of food so much and the exercise has gone. Now every children have gadget by the 2 years or even 1 years of age. I see every mother give them the gadgets and they always on the gadgets. And when the children on the gadgets, they tend to eat more, they don't exercise, and finally they'll end up with the obesity by the time they become 10 to 12 years of age. And we see very commonly nowadays that every month there will be 5 to 6 children at this age coming with the type 2 diabetes. And that's a huge problem, believe me, because we will not be able to handle these children for very long time, because this will increase rampantly. So it is, as a physician, as a hospital, and as a society's responsibility to make our children run. They should earn their meal rather than we give them the easy way to have their meal and be on the gadget all the time. However, still, if children develop type 2 diabetes, I can say it's a better form compared to the type 1 diabetes, but because most of the children will not be requiring insulin, they may be even off medication also if they lose some amount of weight, and even they can be controlled very well with even very little medicines. So it's important that we take care of our children in very good way. Don't make them become obese. Keep the health of whole family as a good. Avoid the high uh, refined carbohydrate in the form of the sugar and the maida, exactly, which is very harmful. So we should avoid the maida as much as possible in our daily life routine, and that way we can take care of these children who are prone to become type 2 diabetic or are having type 2 diabetes.